Scientific Committee Chair Josep Tabernero gives an overview on what attendees can expect to see at this major event.
First of all, I would like to introduce myself. I'm Josep Tabernero, medical oncologist, and this year I serve as the chairman of the scientific committee for the ESMO 2012 meeting here in Vienna, and I would like to welcome you. So for us, it's really a pleasure to be here. This year, actually in the meeting, this is going to be the best meeting that we have had at ESMO, not only in the number of attendees, that it's going to be close to 17,000, but also in the quality of the presentations, the number of different studies that are going to be presented, either phase 3 studies, but also early clinical trials, phase 1 studies. So we are going to have, we have had actually a total of 2,500 submissions of abstracts, and at the end, most of them have been presented. And this is really a major increase respect to the previous meeting that we had in Milan, the ESMO 2010 meeting. And actually, this is especially important, taking in consideration the economical situation, the economical environment that most of the countries have. But this really makes the point that in order to have discussion, interaction, medical oncologists from worldwide, not only from Europe, but from several countries, are going to come here during these days. And we are going to have an excellent meeting with several sessions, with a lot of interaction. There are going to be discussion sessions, also controversies. There are several topics that for the oncology community are questionable, and we are going to have this kind of sessions with a lot of interaction with all the attendees. Interestingly, we are going to have the results of several studies, as mentioned before, phase 3 studies, but also phase 1 studies, and more importantly, we have had late-breaking abstracts. So this means that this is information that has not been presented before, that it's going to be really very important because it's practice changing in most of the occasions, and the quality of these sessions and these abstracts actually has made that we are going to have 2 presidential sessions in order to present this data, but also to discuss this data. For example, in the field of lung cancer, we are going to have the results of a new drug called crizotinib, the first phase 3 study in this setting for a particular population of patients, the ALK translocated population, and the results are going to be quite definitive for this population of patients. In the same way, we are going to have new data on a new drug for renal cell carcinoma called pazopanib that is going to change the standard of care of the treatment of these patients. And in the same way, for example, for the HER2 breast cancer population, actually we are going to have very interesting data on the duration of the treatment in the adjuvant setting with trastuzumab. I mean, and these are only perhaps I would say, the most important highlights, but as mentioned before, the quality of these presentations has prompted to have 2 presidential sessions instead of 1. So you can understand that there is going to be a lot of information, a lot of discussion, and I think that the attendees are going to satisfy from the meeting.